going to clear up so many of the mysteries of how to properly engage your core, how to use your pelvic floor, and what core training strategies you can use to get back into that heavy lifting stuff. So first, what we're going to talk about, so when it comes to core training and your pelvic floor, what's important to remember is that your core and your pelvic floor work together in a muscle, in a muscle group known as the core four. So these muscles include the diaphragm, your TVA or your transverse abs, your multifidus, which are really tiny muscles along the lumbar part of your spine, and your pelvic floor. So these muscles will work together in engaging your core. Okay, so we're engaging the deep core. So the superficial muscles right here, your six pack, although I don't have much of a six pack myself, but these muscles here, these are known as the superficial core muscles, right? So what we're really talking about is the musculature underneath it all, because yeah, your diaphragm and your pelvic floor are very important in when it comes to engaging your core, right? So when we engage our core, we're also engaging the other muscles like the multifidus in the lumbar spine, as well as the TVA. So when we talk about Kegels, what tends to happen is that when your pelvic floor engages on the exhale, for the most part, everybody has a different breathing strategy that works for them. Generally speaking, for a lot of people or for the general population, I will cue the Kegel on the exhale. So inhale in, exhale on the exertion with the Kegel. So that's kind of where I'm going from, because there are a few different breathing strategies to utilize when navigating your pelvic health. So the exhale and Kegel on exertion doesn't work for everybody, but for the purposes of this, that's where we're gonna go. When we're talking about the core four, what we're looking at here is a stacked rib over hips position. So this is going to help keep you in alignment so that your diaphragm and your pelvic floor are directly in line with one another. What tends to happen for a lot of people, especially people that have an anterior or posterior pelvic tilt, maybe they roll their shoulders forward, is that the pelvic floor shifts out of alignment with the diaphragm, and your diaphragm can't completely relax and contract along with your pelvic floor. And we need your diaphragm to be able to do both so that you can engage your core efficiently. So first of all, stand in alignment, neutral position, ribs in line or stacked directly over your hips. We want to make sure that, yeah, we're in a neutral alignment. Neutral alignment is relative to the person. So, if you're dealing with scoliosis, for example, you may notice that you're in neutral for you. So don't overthink alignment. Just as long as your ribs are over your hips, we'll start there, and then you can start training forward to really dial in the alignment. Now, personally, I don't worry about alignment as much as a lot of other people do. But when we are, lifting, we do want to be in a neutral alignment so that we can optimize that lift. So your core training will work alongside your pelvic floor. Now, how we do this is going to be based on where you're starting from. So if you're just brand new and you're just kind of starting off with the rehab phase, then what we do is we kind of start from, the floor. We'll start with some floor exercises and work your way up to body weight. So when it comes to engaging your core, what we look at, or what we want to accomplish here, is inhale in through the nose. When you exhale through your mouth, like you're blowing through a straw. What's really interesting, and if you want to try it now, try it with me. Just make sure that you're sitting upright, ribs stacked over hips. Deep breath in through your nose. Exhale through your mouth like you're blowing out through a straw. What this does is that it automatically turns your TVA on. So it's automatically activating it so that you don't have to think about it. So try it. Feel it? You feel a little something in your lower abs. That's your TVA, your transverse abs turning on or activating. Okay, so we're looking for that activation. Now, if you can't get that activation in, then that's where I would add in a Kegel. So deep breath in through your nose, out through your mouth, and as you exhale, what you're going to do is gently lift your pelvic floor up and in. Okay? This is going to engage your core from the inside. So this is going to this is going to turn on or activate all of the muscles that I've just mentioned. So your diaphragm, your TVA, your pelvic floor, and your multifidus. Almost forgot that last one in there. So it's going to engage all of those muscles. So it's going to give you more stability, but it's also going to help train the automaticity of your core activating. So if you need to add in that Kegel to get that core activation going, then what you can do is work with that for a couple of weeks, play around with it. So, you know, you don't have to stick with body weight or floor exercises forever, or the low impact work. You don't have to stick with that forever. But what you can do is start working on coordinating your pelvic floor to automatically turn on with your deep core automatically. So doing those Kegels for maybe, you know, like 2 or 3 weeks, see how it goes. It's going to take some practice, so please don't get discouraged if you don't get it right away. It does take practice, but week by week, try progressing an exercise even more, and then gradually move away from the Kegels. So if you have an exercise that feels good and you're not experiencing any heaviness or that prolapsy feeling, then gradually move away from, or try it without the Kegel. So we'll take a step back. Try it without the Kegel and see how that feels. If you're not experiencing symptoms, then that's great. That's great feedback. That's letting me know that your pelvic floor is able to react automatically with movement. So there's coordination there, which is great. If not, then keep up with your core training and your pelvic floor muscle training for another week or so, and then come back to it. By no means does this mean that your body isn't capable. It's going to take some practice, because what we're doing is we're creating new pathways between your brain and your vagina, which sounds funny when I say it out loud, but you're learning a new skill. This is a new skill, and it's going to take time for that muscle memory to kind of take over. When that does, then you pull away from the Kegels. The reason why we want to start with some core training is because it is low impact, and really your core is the core of your body. So we want to make sure that we're building that strong foundation from the core throughout your entire body. And as I mentioned earlier, I find that it's a lot easier in the beginning, if you're just starting out, to do some core training exercises that are on the floor to get that timing, to get that coordination down with your pelvic floor. And you know, when you master that, that's when it's time to move on and go on to the bigger and better, or well, they're not better, just bigger and different things. So is diastasis recti a problem? So another question that comes up a lot, especially in pregnancy and postpartum, is that the diastasis that can kind of hang out for a while after pregnancy. So just to give you an overview of what diastasis is, or diastasis recti, DRA, is just a separation of the left and right rectus muscles, and it's separating from the tissue known as the linea alba. So it's a connective tissue, and what happens is that your abs, as your belly gets bigger, your abs make way for baby, and the linea alba stretches and the ab muscles will kind of separate a little bit. So this is 100% normal. This is what your body is supposed to do during pregnancy to make way for baby, especially if you've got a bigger baby on your hands. And then postpartum, it is again common, but with pelvic floor muscle training, you can adapt and train your core so that the diastasis may minimize. So what I want to say about diastasis recti is that we can't always close the gap. And, you know, even before baby, there is still a small gap there, and then when it widens. So for some women, they stay a little bit wider after pregnancy, but what we look at and what we want to address is that linea alba. Is it strong or is it squishy? If it's squishy, go back to your pelvic floor work. So when it comes to diastasis recti, as I said, it is 100% normal. It's a normal part of pregnancy. It's a normal part of postpartum, got that a little backwards, postpartum. And after, you know, with pelvic floor and core muscle training, we can retrain the core to be strong again. We can retrain that linea alba, and that's where the Kegel comes in, because what's really interesting is if you do feel a little bit squishy, if you add in a Kegel, sometimes what that will do for your core is actually engage that linea alba. So that's a really cool little thing that the deep core training, the Kegels, the pelvic floor muscle training will do. It'll activate that. Because again, what we're looking at is just how strong that connective tissue is. And that's really the starting basis. So I walk you through all of that in Stronger to the Core, that 5-day program that I just mentioned. So generally speaking, I don't worry about diastasis unless I have to. But really it's the same sort of principles as pelvic floor muscle training. So you're going to start off with some floor exercises, really mastering that pelvic floor engagement so that we're working that deep core, retraining that deep core, and then we progress to more impactful type exercises and programming. So if you have any questions about diastasis recti, please let me know. Again, I know that there's a lot of fear going around about it. It's nothing new. It's been out there for a while, so I'm happy to clear up some of your concerns if you have any. We're going to talk about some cues, some common cues to activate your core. Now, one of my clients reached out to me last week. She's a new client. She's actually another fitness coach. She's, you know, very well versed in fitness, in weightlifting, in CrossFit. You know, lots of experience there. But she asked how you're supposed to engage the core in my Strength and Lady Parts program. When I had explained, you know, what we are going to do that's a little bit different, she was like, well, I hold my breath and, you know, my belly button goes to the spine. I go belly button to spine. And that's a common cue that is used a lot in the strength and conditioning community. Now, the problem with that, and this is why I needed my balloon, is, well, I'll show you. So imagine this as your diaphragm. Here's your pelvic floor, and then we've got your abs here, right? So if this is the belly button here, and we're going belly button to spine, trying to get in the middle of here. So if we go belly button to spine, well, look what's happening. The intra-abdominal pressure presses upward, or it goes, trying to do this, but this balloon isn't exactly cooperating with me, or that intra-abdominal pressure is going to push it downward onto your pelvic floor. So when that happens, the pelvic floor muscles aren't able to support those pelvic organs. So if you are experiencing symptoms from your prolapse, you're peeing, you've got some pain, and you're holding your breath going belly button to spine, it could be that your all that intra-abdominal pressure is pushing downward onto your pelvic floor, and your pelvic floor is kind of giving way because there's just so much pressure there. That's when you feel that balding and that heaviness. So when you're lifting something heavy and you add in your Kegel, which you can do, and I like to do it when I'm lifting, you know, when I'm working towards my 1 rep max, when I'm going pretty heavy, probably 80 to 85% of my 1 rep max and above, I will add in a Kegel with those lifts, just for a little extra support. And really it's like a weight training belt or an internal weight belt. So it's giving you that support, it's giving you that spinal, it's still giving you all of the same things that you want when lifting heavy, but it's not pushing down on your pelvic floor. It's actually lifting your pelvic floor up and in, which will better stabilize your core. It'll better manage that intra-abdominal pressure and help you use it more effectively. So if you're going belly button to spine and that intra-abdominal pressure is pushing down on the pelvic floor, you're losing that core stability. You're losing that support for your spine. You're not able to support your pelvic organs as they need. And for some women, this is where they pee. So if this is you, try adding in a Kegel when you lift heavy, because it will stabilize you a lot better, because you've got that intra-abdominal pressure that's more evenly balanced with the Kegel. So when you're lifting it up and in, the air kind of stays even. Okay, so it's going to be evenly balanced throughout your core cavity. I guess that's all I wanted to cover for today. Because again, you know, there seems to be a lot of confusion with how to engage your core so that it works with your pelvic floor, or engage your core with exercise, whether you're just starting out or lifting the heavy, sweaty stuff. So again, just to recap, your core training works with your pelvic floor. They work together on a deeper level known as your deep core. So when we are ribs stacked over hips, your diaphragm is seated directly over your pelvic floor, which is going to allow more movement within the core, or with your diaphragm and your pelvic floor. Inhaling through your nose, exhaling through your mouth like you're blowing through a straw is going to help you engage the TVA naturally. Now, if you find that you're still struggling with a TVA, then it is, I recommend that you do take a step back and definitely go through my 5-day Stronger to the Core training program, because that's going to help you navigate, get lots of practice, and start building that foundation so that you can get back to that heavy, sweaty stuff. But when you exhale through your mouth, like you're blowing through the straw on exertion, that's going to cue your body to start activating the deep core. over time, you won't have to rely on those Kegels so much. But if you do want to add in a Kegel with your heavier lifts, then definitely go for it, because it's going to help you be more stable and give you some more strength and even improve performance. Now, one thing that I didn't mention with the breathing is that you want to blow before you go. So you inhale through your mouth, inhale through your nose, exhale through your mouth, a split second before you exert. That's when you add in your Kegel. So that was something that I forgot to mention earlier on. Diastasis, not really something that I dig too deep into, because when we're training your pelvic floor, your core or your diastasis will adapt and it will change as well. So they work together in that sense. So we want to do those Kegels forever. We do want to back off of those Kegels eventually, because things can go the other way. And when you're doing your workouts, your core and your pelvic floor are working. So they're working too. So adding in that Kegel, usually I recommend it if you're doing an exercise that's bringing on symptoms. Now, belly button to spine, again, it's not a bad cue, but for a lot of women, they find that they are a little bit more symptomatic because that intra-abdominal pressure is pushing down onto the pelvic floor, and the pelvic floor kind of gives way a little bit. So introducing that Kegel is definitely helpful. You don't want to do it forever, but you can add them in when you start adding heavier weights. Okay, so for me, where I'm at personally, I don't need to worry about Kegels so much, but I do use them if I'm heading towards my 1 rep max. So again, everybody's going to be different depending on where you're starting from. So if you do have any questions, you want to dig into some specifics, please let me know. All right there. So take care, have a great day. And if you have any questions, I'm here to help always. So we'll see you soon. We'll see you next week.